Good evening, everyone. We'll wait for a few more minutes to see if others join. If not, we'll just start a session. So, good evening, everyone. Am I audible?
Yes, madam.
Okay, thank you. So, I guess we can start. Let me just share my screen. Can you people see this? I'm assuming that's
Yeah,
a
it's
yes.
visible.
Yeah, okay. Thanks for responding. So, welcome everyone to the week 8 session of the NPTEL online course Drug Delivery Principles and Engineering. And as you all know, we have been discussing some previous year solved assignments. So, let's begin with this session. I'll start with some of the topics which have been covered in this week 8 lectures. As you might have been attending the previous lectures as well, we have been discussing the different routes of drug delivery, and we have already discussed the advantages and disadvantages for both oral, intramuscular, subcutaneous, as well as transdermal routes. We saw transdermal drug delivery route in much detail, where we have seen that there are certain barriers for the drug to be delivered when we are giving it through the skin. And then we have also seen the ways to enhance this transdermal drug delivery using certain chemical methods, physical methods, or using electrical current. And this discussion ended with something known as microneedles, which is a very good application to enhance the transdermal drug delivery, in which we make very tiny needles of the dimension of 100 to 500 microns, and then these are inserted in the skin. So this 100 to 500 microns in length is actually the length which will penetrate through the dead lipid layer which is present on our skin, and it will not harm the nerve, so the patient won't feel any pain. Next, we have seen some applications of these microneedles as well in the lectures. Next, route of drug delivery is inhalation. So there are certain advantages of inhalation. Inhalation is basically taking the drug through a nasal route, and as you might be knowing that this will bypass the first pass metabolism, which is what we desire, because in first pass metabolism, if you remember from the previous discussions, the drug, if we take orally, it will go through the gastrointestinal route and will be carried from the stomach to the liver, where it will be metabolized quickly. That's why most of the drug will be lost even before reaching the site of action. So inhalation is good for bypassing the first pass metabolism. Also, it provides a great method to deliver drugs locally to the lungs. For example, if you want to treat a disease which is only localized to lungs, for example, let's say it's a cough disease or it's cystic fibrosis, in that case inhalation will help because most of your drug will be bioavailable to the lungs. The disadvantages associated with inhalation is the systemic absorption of selective molecule happens. For example, your molecule has to be in the desired range of size for it to be absorbed, because since whenever it's taken through the nasal route in the lungs, it has to pass through a lot of airways and then get into the blood. So if you want the drug to reach all over the body, that means it has to be in the blood, which is known as systemic absorption. That happens only for selective molecules, only for those molecules which will reach the deep lungs. If not, then this is not a very good method to deliver drug. And the way it can be done is using nebulizers and dry powder inhalers. They have their own advantages and disadvantages, so it all depends on the application, which disease are you trying to treat. That will help you select which one will you go for. Next, there is a concept known as aerodynamic diameter whenever you are dealing with inhalation route. This is used to make the particles porous to increase its physical diameter. Then so aerodynamic diameter is basically a theoretical concept, it's not a physical value. And this is done because since your particles, if they are of a smaller size, they can be phagocytosed by the macrophages which are present in the alveolar sac. We can discuss about this later in the questions as well. So to avoid that, you deliberately make the particles porous, you increase the physical diameter, but the aerodynamic diameter will still remain in the range which is approved for inhalation based drug delivery. Several other routes of delivery were discussed, such as buccal or sublingual. This has been a very traditional method. I don't think it's very widely used right now, but this is one of the routes available, where you take a tablet and you place it just below your tongue. And this, even though this might seem like it's an oral route, but it actually bypasses the first pass metabolism, because there is a different blood vessel that carries the drug that is absorbed from the buccal cavity directly towards to the blood, and then it can be absorbed for systemic circulation. Another method is intra-articular delivery, where this is also local delivery, helps in local delivery to increase the concentration of your drug in the knee joints. So you can directly inject whatever drug you have into the knee joints. So this is most often used for diseases such as rheumatoid arthritis, which are localized towards the knee. The disadvantage associated with this method is it requires trained personnel. A patient cannot self-administer it, so the patient always has to go to the hospital to get the drug dose. Another method is intravenous delivery, which is fairly common. You might have seen in the hospitals people getting salines or injections through IV. And advantages of this method is it is 100% bioavailable. It has immediate effect, meaning whatever drug you will be injecting directly into the blood can quickly circulate towards all your body, and then it can have immediate effect. For example, if a patient is suffering from a heart stroke, then intravenous becomes very important because then you can easily have the effect of the drug. And disadvantages of this method, it's invasive because you're injecting something. Patients are not compliant towards injections, but when it becomes necessary, then they don't have an option. And also it requires trained personnel because a patient cannot self-administer intravenous delivery. It's very difficult to look for a vein. Also, sterility becomes an issue because now you are directly injecting your drug molecule into the blood. Previous all the methods, for example, let's say subcutaneous or intramuscular or transdermal or inhalation, they had several layers before the drug comes into the blood and circulates to all your body. Now what happens in intravenous delivery, since you're directly injecting it into the blood, if your drug formulation is not sterile, there is a possibility that you can introduce some bacterial infection, and that can also quickly circulate throughout the blood. So this becomes an issue whenever you're dealing with intravenous delivery. So all of these points were covered in the lecture. So with this basic information, we can start with the assignment. Anybody has any doubts? So the first question of the assignment, we'll go ahead with the assignment discussion now. The first question is, what is the ideal size range of the nanoparticles such that it can traverse through the smallest capillaries inside the body and not get cleared by the renal system? Do you guys have any answers?
10 nanometer to 5 micron.
10 nanometer to 5 micron. Okay, that's the first option. Anybody else?
Yes, ma'am. First option, 10 nanometers to 5 micron.
Okay, thanks for answering. Anybody else has any other answer?
First option, madam.
Okay. Okay, most of you are saying first option. Let's see. Yeah, all of you are correct. The right answer is 10 nanometer to 5 microns. So the question is, it should be the nanoparticle should easily travel through the smallest capillaries inside the body and not get cleared by the renal system. So in some of our first discussions, if you remember, this is how kidney clears the renal, meaning kidney clears the drugs in the body. So if you have particles which are in between 4 and 11 nanometer, they can easily be cleared out of the kidney, so they won't remain in the blood any longer. So if your particles are below 10 nanometer, they can easily be cleared. So to avoid this linear clearance of the drug, what you can do is you can make your nanoparticles which are above 10 nanometer. Now the smallest capillaries which we have in our body, which reaches through the smallest niches in the body, is of the dimension of 5 micron. So if you want your particle to not clog these capillaries, so there is a possibility that you maybe design a particle, it works very well in vitro, and then you are going for the in vivo studies, and there you understand that your particle is so bigger than 5 micron, that it can actually clog the capillaries. So that will be seen as a failure of treatment. Instead of treating some other disease, you are creating different problems. So to avoid that, ideally your nanoparticle should be in between 10 nanometer to 5 micron, so that it stays in the body for a longer time and also doesn't cause any clogging problems. Is that clear? Okay, then I'll move on towards the next question. Next is, which of the following is an ionic liquid? So this is discussed in one of the lectures of this week. If you guys have listened to it, you might be able to answer. Anybody?
Sodium chloride, saline solution, madam.
Sorry?
0.9 saline solution.
Okay, the third option.
Is ionic liquid.
Okay, third option. Okay. Anybody else?
I thought it was,
Sorry, both of you answered at the same time. Can you go one by one?
what about choline and geranate? That's not the right answer.
Okay, we'll discuss. That's your answer, right? It's the second option.
Right.
Okay, hold on to that. We'll discuss. Anybody else?
Third option, madam.
Third option. Okay. Others? Okay, no more responses. We'll discuss the answer then. The correct answer is second option, choline and geranate. So let's discuss why this is the right answer. So first, let's see what is an ionic liquid. So an ionic liquid is an organic salt which exists as liquids at room temperature. So ionic meaning it will dissociate into ions once you add it into an aqueous solution. So 0.9% saline solution can be an ionic liquid, but not in the context which has been discussed in the lectures here. So your ionic liquids mostly have to be organic salts, which are for example choline and geranic acid. So these ionic liquids are very good solvents because they can dissolve organic, inorganic as well as your polymer substances. So they're mostly used to enhance the transdermal drug delivery. So as you might remember that when you're doing transdermal delivery, you have this dead skin cells which are rich in lipids. So if you directly put something through the transdermal route, it might not get absorbed. The drug might not get absorbed. So to clear away the lipid layer, you can use certain liquids such as choline and geranic acid, and that will then dissolve the lipid layer and then let your drug pass through it. So 0.9% saline solution could have been a right answer, but not in the context which is discussed here. So the right answer is choline and geranate. Since the question is which one of the following is an ionic liquid, can be a bit ambiguous, but I'm sure such questions won't be there in the exam because ideally third option should have been the right answer. But since this is how the question was formulated, the correct answer is choline and geranate. Did you guys get this?
Yes, ma'am. Yes.
Okay. Thank you. Okay, then moving on. The third question is the density of two particles are in a ratio 1:16. What is the ratio of their aerodynamic diameters given all other parameters are the same? Any guesses? This can
Third
be a
option.
Third option. Okay, 1:4. Anybody else? You guys can quickly calculate it using your paper pen. Thanks for answering. Anybody else? Okay, nobody? So we'll discuss the answer. Yes, the correct answer is 1:4. So aerodynamic diameter is related to the physical diameter using this equation where your aerodynamic diameter is is directly proportional to the physical diameter and root of the density. Since it says that all other parameters are the same, what you can do, you can take the ratio of these two densities, these two equations, aerodynamic diameter of first particle to second, and then it will just be a under root ratio of the densities that is already given to you, and then if you solve this, you will get 1:4. Is this clear?
Yeah, yes, ma'am, it's clear.
Okay.
Yes, ma'am.
Okay, thank you. Okay, then moving ahead, fourth question. What size range of particles are well suited for deep lung delivery?
1 to 5 micron.
Okay, that's one response. Thanks. Anybody else?
Yes, it's micron range only, madam.
Okay, sure. Thanks.
It's 1 to 5 micron.
Okay. Thank you.
One to 5 micron, ma'am.
Okay, thank you for answering. So all of you have the same response. So, and all of you are correct. The right answer is 1 to 5 micron, because that is the desired range of size, so that it reaches the deep lung. So if you have gone through this slide, here also it is mentioned that if you have your powder particles in the range of 1 to 5 micron, they can reach the deep lung, and then from there they can be absorbed into the bloodstream and can be used for the systemic circulation as well. So that you will get only when you have formulated your particles in this range and you are administering it using this dry powder inhalation. Can you please mute your mic? I guess that's Jayashree. Thank you. Okay. Is this clear? So if you have your particles in this range, it can also be there's a possibility that all of them will not be absorbed at the same time, and they can actually form a drug depot in this alveolar sac, and then it can lead to sustained release over a period of time. So that's a good point if you are looking for a longer duration of treatment, so that you can only administer the dose once in a week or once in a month, let's say, and then it's more patient compliant if you have less dosing involved in your treatment. Okay, no doubts here. Then we'll move on. Next question is the mechanism of particle deposition into the lungs for large airways, bronchioles and alveoli are in the order of? Any guesses?
The first option.
Okay, the first option.
Impaction, sedimentation, and diffusion.
Okay. Thank you. Anybody
Yes.
else?
First option ನೋಡಿ madam.
Okay. Others? Okay, no more responses, then we can discuss this. Yeah, both of you are correct. The right answer is impaction, gravitational sedimentation, Brownian diffusion. So whenever you're administering a drug through inhalation route, this is what happens. So first the drug encounters trachea, and then it starts dividing into the bronchi and then bronchioles. So this division keeps on happening, and then this keeps on happening for, let's say, some 17 to 20 times, where the size of, let me take a laser pointer, the size of these airways becomes smaller and smaller as you go on dividing it. So whenever you deliver the drug through inhalation route, first it goes through this larger airways, and then the first mechanism that happens is impaction, where, let's say, this red pointer is your drug. It will come first and it will hit these walls here because of inertia, because they have a certain mass to them, and because of that mass they have certain momentum as well, and then because in inhalation, if you guys have noticed, people who take these asthma pumps and such, they are asked to take a very long breath so that it has certain velocity. The drug particles also have certain velocity associated to it, and as a result, because of their mass and their velocity, they first impact these walls of the airways. So the first mechanism that happens is impaction. Later on, gravity takes over. If your particle is in the range of 1 to 5 microns, which is quite heavier, so compared to the nanometer particles, so because of gravity they will start settling, and then whenever they reach the smaller, very small bronchioles and towards the alveolar ducts, they will undergo diffusion because of something known as Brownian diffusion, where they'll randomly keep on hitting each other, and because of that impact they'll further start settling down. So these are the mechanisms which help, which are the mechanism behind inhalation route, where you first have impaction, then gravity, and then Brownian diffusion. So if your particles are of a very smaller size, let's say you make some 50 nanometer particle, which is lesser than 1 micron, it will have a very good impact because it's smaller in size. But then since the patient is constantly inhaling and exhaling air, and because these particles are very smaller, before even reaching these smaller bronchioles, they'll be exhaled out. So you can't have a particle which is very small. Also, if you have a very large particle, let's say you have a 10 micron particle, it will have impact here, and then there is a possibility that it might get stuck here because it has a very high mass, larger mass. It won't be able to gravitate here, and there's a possibility that it can get stuck in these walls. So that is why the desired range for your deep lung delivery is always 1 to 5 micron. Is this clear?
Yes, madam. Yes.
Yeah. Thank you. Okay, then moving ahead. Next question is, where will particles of size 20 micron mainly deposit after dry powder inhalation? 2 correct answers.
Mouth and throat and large airways.
Okay, that's one response. Thank you. Anybody else wants to give it a try?
First option, nose, ma'am.
Okay. Others? Thanks for answering. No other responses? Okay, let's discuss. Yes, the first one who answered was correct. Mouth and throat and large airways. For nose will be the first place where your particles have to go through when you're taking dry powder inhalation. But the question is asking us, where will it be deposited? So if you have gone through the lectures, you might have come across this graph where if your particles are of a very high range, they will mostly be deposited in larger airways and mouth and throat. And we just discussed few minutes back that the deeper the alveolar regions, actually your particle is very large, 20 micron. To settle into the alveolar region, it will mostly be trapped in the upper bronchiolar region and mouth and throat, in the larger airways of the lungs, and they will not be able to reach the alveolar region. So the correct answer for this question is mouth and throat and large airways. Is it clear? Any doubts here?
No, ma'am.
Okay. Thank you. Let's go ahead then. Next question is, which one of the following is false for rectal administration? Any guesses?
Uncomfortable drug degradation by bacteria flow.
Okay, the last two options. Okay. Anybody else?
Madam, only one option is correct.
Yeah, only one option is correct.
Would it be widely recommended and followed?
Yeah. Okay. So you're correct. The first one who answered, you have to answer one correct option, and the question is false statement. So I think you actually answered the correct statements for rectal
Madam,
administration.
third option, madam.
Yeah, third option. Yes. Thank you for answering, all of you. So that is actually a disadvantage of this route of administration. The advantages is, first of all, it bypasses the first pass metabolism, and this one is only administered to children because it's highly uncomfortable for adults. And because in children, smaller children, it's very difficult to locate the blood vessel, so you can't actually go for IV. So this route is beneficial for them, and since it's an uncomfortable and it needs a trained personnel, it's not actually widely recommended and followed method. So this is only followed in children. So the false statement for this is it is widely recommended, which is the false answer for this. Making sense? Okay, I'll move on then. Next is, which of these statements are not advantageous for intravenous delivery? Here you have to pick two options.
It's invasive
Okay,
and also chance of irritation and infection.
okay, cool. Thank you. Others?
Last option, ma'am.
Last option. Okay. Do you have any other answer, since we are supposed to pick two options?
All of these questions are confusion, madam.
Yes. So this is what will keep on happening in the exam if the same person sets your questions. So these questions are actually not set up by the professor. These are set up by the TA students from the previous session. So the only way to deal with these questions is you read the question first of all. So it's asking us what is not advantages for intravenous delivery. So this means it's asking the disadvantages of this route. So then it will become easier for you to
First and last option, madam.
Yes,
okay,
ma'am.
yeah. Okay, sure. Thanks. So you're correct. The right option is it's invasive, as we discussed few minutes back that this is one of the disadvantages of IV. First of all, it's invasive. So if you ask a patient whether they want a pill or a syrup versus an injection, almost everybody will always say that syrup or a tablet is much beneficial, because taking injections is invasive. Also, it needs a trained personnel, and as I said, since you're directly injecting something into the blood, there is high chances that if your formulation is not sterile, if your needle is not sterile, then it can lead to other infections. Also, one other disadvantage of this system is because almost 100% of your drug is being bioavailable now, you have to very, very carefully design the dose. Even if your dose is slightly higher than what is required, it might cause toxicity to the person. So the disadvantage of this route is it is invasive, and there are chances of irritation and infection. Irritation meaning whenever you're injecting something, that area will slightly become red, and if somebody has higher macrophages in that particular area, then it will lead to irritation. Is this clear?
Yes, ma'am.
Okay. Then we can move on towards the next question. Next is, what are the advantages of using inhalers for drug delivery? Again, you have to choose two correct options.
Good for delivery to the lungs
Okay,
and bypass first pass metabolism.
perfect. Anybody else?
Yes, same, madam. 1 and 4.
Okay, I think somebody else was trying to answer as well. Okay, yeah, both of you are correct. The right answer is it bypasses the first pass metabolism, and it is good for delivery to lungs, as it is a local delivery, and it's very patient compliant as well, since no needles are involved in this. So if such questions, what you can do is you can whenever you go through these lectures, there are I guess some 7 to 8 different routes of drug delivery discussed in this course. So what you can do is you can read through all of these, you can make points of like it's shown in the slide. You take one single round, you study it properly, the advantages and disadvantages. If possible, you can watch videos, YouTube videos for this. It will become more clear, and once you are conceptually clear with this, then these questions shouldn't be a problem. These are actually very good questions to score marks in, because no numericals are involved in this. Okay, then if no more doubts, I'll move on towards the last question of the session. Last is calculate aerodynamic diameter of a polymeric spherical particle with diameter 2 micron and density 4 gram per centimeter cube and shape factor of 1. Report the answer in micrometers. Has anybody solved this? Anybody has the answer? You can take your time to solve.
We have the formula aerodynamic diameter equals the geometric diameter multiplied by the square root of the density, then
Correct.
the shape factor, and the shape factor.
Yeah, so here, since the particle is already spherical, the shape factor doesn't play a role. So
Okay.
yeah, the straightforward formula is your aerodynamic diameter.
Okay. So the geometric diameter is 2 micron.
Yes.
Then density would be 4 by 1. Square root of 4 will be 2.
Right.
4 by 1, and then be 2.
Right.
It's just that if 2 times 2 is 4, report answer in micrometers.
Yeah.
So 2 times 2 is 4, and answer in micrometers. Because it says aerodynamic diameter, by definition, diameter of a sphere with the density of 1 gram per cc.
Yes.
So if it is also in micrometers, maybe answer is 4.
Yeah.
Sure.
You're absolutely correct. I don't know
Yeah.
why they have made it so confusing.
Okay.
But yeah, the straightforward answer is you take the aerodynamic diameter formula, which has a simple conversion of your physical diameter and root of density, and you just put it in the formula, and then you'll get the answer. I don't know what is happening here with this unit conversion. I think they're trying to confuse people.
Yes.
Yeah.
Thank you.
Yeah. Did everybody else get this? Is this clear? Others? Am I audible?
Yes.
Yes, ma'am.
Okay, thanks. So yeah, we have reached the end of the assignment. If anybody wants me to go through the questions once again, if there is a doubt in any other question, or if anybody has joined late, we can do that. Shall I quickly?
Madam,
Yeah.
I'm okay with this session, madam. Just one, I raised an issue. Week 7, madam, not this one.
Okay, sure.
Answer number 5, I marked it correctly.
Can
I
you
said,
tell me the
I-
question?
Question number 5. Okay, one second.
Yeah.
One second. Week 7.
Hmm.
Question number 5. Question number 5. What kind of a drug is not a good candidate for transdermal delivery?
Okay.
Pick 2 choices for 1 point.
Yes.
The correct answers were low. The options were low partition coefficient, high partition coefficient, low molecular weight, and high molecular weight.
Right.
The accepted answers were low partition coefficient
And high molecular weight.
and high molecular weight.
Right.
So there is no partial credit.
No, there is no. So
Okay.
you'll get a point when you answer both of them.
Oh, All right.
Yeah.
Thank you, madam.
Yeah.
Thank you.
So so for people who joined late, I'll just quickly go over all the questions. So the first question was, what is the ideal size range of nanoparticles such that it can traverse through the smallest capillaries inside the body and not get cleared away by the renal system? So the answer is 10 nanometer to 5 micron, because your kidneys can quickly clear particles which are below 10 nanometers, and the smallest capillaries which we have in our body is of the size of 5 micron. So anything above that will clog the capillaries. So the ideal range for your nanoparticles should be 10 nanometer to 5 micron. Next was, which of the following is an ionic liquid? Ionic liquids are organic salts which exist as liquids at room temperature, and these are mostly used because these are good solvents for all polymers as well as organic and inorganic materials. So they are used to enhance transdermal drug delivery, and the correct answer was choline and geranet. Next is, the density of two particles was given, and then we had to calculate the ratio of their aerodynamic diameters. So this is a straightforward formula where aerodynamic diameter is equal to your physical diameter and root of density. So if you put the ratio of density that's given, you'll get the correct answer, which was 1:4. Next, what size range of particles are well suited for deep lung delivery? The correct answer was 1 to 5 micron. Next is, the mechanism of particle deposition into the lungs for large airways, bronchioles and alveoli are in the order of, and this was the correct answer, impaction, gravitational sedimentation and Brownian diffusion. So first your particles hit these walls, which is known as impaction. Then gravity takes over, because they are larger in size, they will gravitate towards the lower bronchioles, and then Brownian diffusion happens. So the correct order is first impaction, then sedimentation and then diffusion. Next was, where will particles of size 20 micron mainly deposit after dry powder inhalation? So since 20 micron is a pretty big size for the particles, the right answer was mouth and throat and large airways, because these particles won't be able to go below the larger airways. They won't be able to travel towards the alveolar sac. So they'll mostly be trapped in mouth and throat and large airways. Next was, which of the following statements is false for rectal administration? The false statement was, it is widely recommended and followed method, which is actually false, because since it's highly uncomfortable and it needs trained personnel, it is not widely recommended and followed method. It is only used for children. Next was, which of these statements are not advantages for intravenous delivery? And the correct answer was invasive and chance of irritation and infection, because it involves injections, so it is invasive. Also, if your formulation is not sterile, you might actually inject patients with certain bacteria or other material which can cause infection, and it can cause irritation as well. Next was, what are the advantages of using inhalers for drug delivery? And the correct answer was, it bypasses the first pass metabolism and it is good for local delivery to lungs. Last question was a numerical, where we had to calculate the aerodynamic diameter of a spherical particle, where we know the physical diameter and the density of that, and if you just put it in the same formula, you will get the answer as 4 as the aerodynamic diameter. So is this clear? Anybody having any doubt here? If not, we can stop the session here and I can meet you guys the next week. Okay, thank you. You have any doubt, Deep?